Hello, everyone. My name is Alexander Morari, and I'm the founder of ITKeyMedia. We are now speaking to Dan Bugariu, the co-founder of a company called Ulpia. And this is a Romanian pioneer in a new type of tech. And I would call this med-ed tech marketplace, Ulpia. The company works now in 11 countries, primarily currently offering educational content in dentistry in English, I understand. And company has plans also to expand to more general med subjects or med like areas, and of course expand language interface or language courses. Bună seara, Dan.
Hi, Alex. Bună seara.
Yeah, so would you agree this is a pretty, less crowded space to be in med-ed tech as such? And with all the online focus, the ever-expanding online focus of many more areas of life, education online will grow in momentum importance to become a norm. Would you agree with that?
For sure, we will grow in this direction. I'm not sure if we will have 100%. I hope it will not be 100% move to online education. I believe more in a hybrid approach. And I think that blended learning, at least for the next 5 to 10 years, will occupy a central point in the educational ecosystem. But yes, indeed, at least in the medical sector, but not just in medical ecosystem, online education is growing. And the last 2 years actually pushed us to grow faster in this online education chapter.
Mm-hmm. And why did you start with the dentistry as such?
Well, it's very simple. The founder of Ulpia startup is coming from dentistry. So the biggest, the largest knowledge we have related to medical sector is directly connected with dentistry. The last 15 years have been dedicated to dentistry. Mm-hmm. And in the last 2 years, the founder, Cătălin Balabello, switched to decided to sell his dentistry clinic and start the entrepreneurial journey.
Wow, that's some switch. Interesting. So there must be a belief in the scalability or like the promise for future potential, right, of the company. And where do you think this potential comes from? The approach is to be more effective educational tool than standard conservative ways of teaching and educating dentists? Or is it, what I want to say is this: do you plan to be core fundamental kind of platform to educate new dentists, or is it a subsidiary, or is it a auxiliary subsidiary to a more classical way of educating dentists?
I think I will have to explain 2 things related to your question. First of all, our plan is to close the gap between the educational marketplace and the product marketplace. We believe that doctors are a special client. Why special client? Because they are investing 10 years in developing special skills. And after that, they are dedicating, most of them, their entire life to improve and save our lives. So we can say in an entrepreneurship language that they have the entire skin in this game. And we believe that the biggest asset they are building is their reputation, and their reputation is directly connected with their result in this mission to improve and save human lives. So for them, it's very important to increase the knowledge which will allow them to increase this reputation. And this reputation is not just a package. It's directly connected with what they can do for us, improving and saving our lives. Having this in mind, we have decided that we need to create that special place in which they are enabled to get those results. And those results are not related just to education, but to education plus all the equipments, instruments, materials that they need to connect with this education in a safe place to test them in order to get results. And in this journey, they need support from the community and from the lectors which already have done it. So this is our bet. We are building and we are closing the gap between educational marketplace and the product marketplace. And we do that because we believe that doctors are heroes of our life, and they deserve to get support from all the partners which are growing, are developing values in this area. And this is one part of my answer. The second part is that we are not seeing ourselves as a competitor for other types of stakeholders, but more a partner. We are partnering with universities, we are partnering with medical publications, we are partnering with an event organizer, we are partnering with producer and with vendors, and we have for them what they need, because our purpose is to build the ecosystem in which the doctors are getting the right support for their growth.
Mm-hmm. When you mentioned events, are these events online or offline as well?
Both of them. We are supporting online events, we are supporting hybrid events, and of course we have done in the past a lot of offline events in order to learn everything that's necessary in order to move them successfully in online.
Mm-hmm. When I say equipment, that you are a linking element between doctors and knowledge and hardware or equipment, right, for the dentistry. Well, what do you mean exactly? You are acting as a, should I say, marketplace or a distribution channel for new or innovative, I understand, hardware used in dentistry, or what's the approach there? And you take, I mean, speaking business-wise as well, and then you act as a marketplace, taking your cut in this sold merchandise, I understand?
We think on the market are very good players in this area, so we will not duplicate what is already on the market. We don't go in that direction in which we will build two marketplace, one for education and one for products. We have an educational marketplace and we link it with the products, instruments, materials, which are sold by our stakeholders like producer or vendors, and we're doing by partnering with them. We don't build a marketplace, but we sell together with our partners connected with the educational components. We sell these products which together with the procedures and the knowledge from medical sector are producing the expected results.
Mm-hmm. Dan, take me through key steps in my journey as a, let's say, a dentist, doctor, and so that I'm probably better understand, and we explain to the viewers as well how this journey looks. And let's say I'm first time on your platform, and then what are the key milestones, steps in this journey? So I sign up and
The question is great. It's not simple to answer it, but you have to have an easy answer in order to sell the product. First of all, Ulpia is a customized platform, customized and adapted platform, dedicated to healthcare professional. that close the gap between educational and selling the right product which will generate results. If you, as a doctor, go to the platform, the first part is in any platform is to onboard on the platform. In order to customize and personalize the content dedicated to you, what you have to do first time is to create a special profile, a customized profile. And the customized profile will generate later the right content for you. What kind of content is the next question? So we have the next type of content: events, lecturing, courses, and the future we will have articles, and of course products. But products we don't sell separately, but directly connected with events and trainings, which are presenting most of the time results and procedure to go to those results. So after you are doing that, you are able to see which is the content appropriate to you. And depending on your customization, you will get access to those which are of interest, especially for you. And when you are attending an event or a course, you will have the possibility to link the knowledge, the procedure, with the equipment, instruments, and we are developing this module right now. So it's not ready. We are doing it and solve it, but not automatically as we would like to achieve it during 2022. As you know, we are in pre-seed round, and we are actually changing a little bit the business model. So we have a lot of things to achieve during 2022. Yeah.
And what are the changes, by the way? One or two key changes that you think would improve performance?
At the business model, we are switching from the one-time, which was our old model, to subscription. This is a big change we are opening in the next months.
But this is already live on your website, as I understand, this monthly subscriptions. There are two options, monthly and yearly, I guess, right? From what I see.
Yes, that's true.
This is live already. Okay, interesting. And it used to be one-time, lifetime, you want to say?
Yes, but most of the revenues in 2020 and 2020 have been coming from one-time payment. And we have changed the model at the end of 2021. We are now adjusting the current subscription, and we will move, and our objective is in 2022 to have more from recurring revenue than from one-time payment from our customers.
But I understand it worked pretty well for you, and this lifetime kind of a one-time payment, with this you managed to earn, what was that, around 200,000 euro by end of 2021, right? That's true. And also this boosts
even if you are at pre-seed level, we started to have revenue in 2021. And we decided that in 2022, we will not do it the same, but we will go in the recurring direction. And this is probably one of the most important objective in 2022. Of course, there are other things we have on our plate related to the platform development. And of course, we are targeting Central East of Europe. We already organize events in 11 countries, but we need to increase the membership base and also the customers, with the users base which are connected with our platform.
As far as markets for expansion, which are your top priorities for expansion in 2022?
We will organize several events starting with Italy. And we are now deciding which will be the next the countries which will open the series of events we are starting to plan for open.
How do you qualify your lecturers or those content producers? Is there a verification? Medically speaking, or do you qualify the creators somehow before they give you the content, video, and right, mostly?
We are open platform. This is one of the key differentiator comparing with other competitors. And of course, that being an open platform comes with a responsibility from our side, how you can be open and in the same time minimal curate the content on the platform.
Yeah,
we are monitoring, at least in the first year, it's essential to create quality content, because quality content will bring attention and will sell subscriptions. So it's a challenging part of our business to keep the platform open and in the same time assure that the content is visible to us, and if it's not appropriate, and we observe that to take action.
Yeah, what I mean is it's not like your cat videos, but where your subjective perception could be either you like it or you don't, but that's entertainment. It's a cat video does not have to be compliant with the safety regulations and all of this stuff, right? So this is what's, I think, among probably biggest challenges to vet and qualify the creators and then the content on the website. And that's why I'm asking. That's why I'm asking this as well. You cannot just rely. Yeah, you know what I mean. Like from the outside. Oh, sorry. Go on.
Sorry to interrupt. This is another side of the question. If this is a question, we have an approval process for lectors. In the medical world, if you are working with different producers and stakeholders which are knowing the market in different countries, we have our way to validate if the new user is actually a lector, a doctor, and he has an image created, and he will not get approval from the platform. He is not proving that for us.
So let's move on, Dan. Now, round number two, ad tech, med tech. I mean, it's a combination, of course, what you're doing. You could say both ad and med tech. Both are gaining momentum worldwide, especially having in mind this boost of online educational products. And round two, we'll try to cover competitors. Which companies, those early stage companies, you would say are your biggest, or let's say most interesting contenders, right, for the spotlight?
Well, on this area, on med education platform, you can think that there are a lot of players on the market, and you need to have something which is different. But I will not discuss with what is on the global level, because the biggest player probably are not in this part of Europe, and are actually have a different type of doing education. But I will refer more to the competition we have in this part, maybe in Central Europe. You have OHES in Belarus country, you have Style Italiano. They are doing something different, but they are successful. Of course, we are looking at universities and publications and other platforms which are owned by big producers. They do similar things. They are part of our competition environment, and we need to understand them and build competitive advantage, compare with what they are doing. We think that the competitive advantage we can build in this direction of having a special way to connect education with those products and services which make a difference, and also offer the community which is taking the same procedure like you. You have the lecturer, you have the support of producer, you have the other 10 or 20 doctors like you, which are interested in this type of procedure, and you have their support. I mean, you have their question. Maybe sometimes you don't have the best question, but there is another doctor which is interested in that specific procedure, which is putting the right question for you too.
Yes, okay, clear, Dan. It's maybe a little bit too early, but still, probably you can define your biggest competitive advantage and describe it in a nutshell compared to your peers in Central Eastern Europe. Like one or two that it's not easy to replicate or not easy to beat you in.
If I will have to choose just one,
okay,
will be the specific way to connect in an open way, so not limited to just one producer. Education with instruments, with materials, with equipment. You need, plus community, you need to get your results. I would say this.
Yeah, and prerequisite to say so probably is not to take money from equipment or product manufacturers, right? And that's why you're focusing on one stream of revenue from subscription by actual doctors. And this is what gives you objectivity. As soon as you crack and you take money from manufacturers of products, equipment, and at the same time doctors, this is where you are not objective and you're not impartial, so to say, right? And then you will be probably slanting or leaning to help a little bit more those that pay your biggest commission, let's say, or anything similar like this.
It's a very good observation. It's a very good observation, and I validate it.
Okay. And here's a provocative question then. Do you think you will be able to stay this way, or you will have to open up maybe to make it a real marketplace for both content providers, but also to serve as a distribution channel or sales channel for manufacturers of products, equipment, and so on at some point?
We don't have this plan yet. I've started to tell you that our position should be created such a way that all the stakeholders from medical ecosystem to have the feeling and for real that we are their partner.
Yeah. Okay.
We should partner with event organizer. We should partner successfully with producer. We should partner correctly with lectors. And each one should win something, should give something and win something from this deal. And we have a specific business model, of course, for each profile.
Dan, let's move on to next, and this a little bit more relaxed, round three. This is where I'm trying to get some pearls of wisdom, you could say, from the founders. I mean, I take it you're a busy businessman, you know, startup co-founder and so on. What are your most effective productivity hacks? And again, not the tools that you're using, but the way of doing things.
First of all, I'm not one of the co-founders. Actually, I'm the main advisor of Ulpia business. So I will give your answer. I'm an active advisor, of course, and I'm part of the executive team. So my answer will come from these shoes, not from the co-founder or a co-founder shoes. You see, there are a lot of things which are already proved they are working. We use them. What is important in startup is speed and energy, focus. All these things you probably hear in any discussion. Probably what is interesting, how you keep it, how you manage them, how you manage the expectation, how you manage the energy. And this is a challenge for us, how we keep our energy up, how we keep our credibility in front of the employees, how we manage efficiency, the objectives, and we are using the same for the classic framework like OKRs and lean methodology and instruments which are classic like CRM and to-do list and project management tool and everything which is already on the market. What I see that it's making a difference for us in this stage is that we are combining an agile approach, which is actually using those 5 seniors which are presented in the project and are covering good enough the marketing, the platform, the domain, the finance, the business. We are putting responsibility on them, and they have the responsibility to find the best way to achieve those objectives. But if you have a look at the, let's say, people who are not having so much experience, we have some combination between flexibility. I mean, you are free to think about the right solutions, but also directions in order to get efficiency. We need to get results in months. That means that we have to give exactly sometimes which are the steps, which are the things, which are the tasks a person should take in order to deliver that.
Okay.
Results. So it's our own methodology, which is combining, and it's not easy, but we managed to find a balance between agility and a more disciplined and command and conquer approach.
And which is a consequence of you being pretty much experienced professionals yourselves, right? I mean, in the team. So you're a co-founder with huge experience as a medical doctor or even an entrepreneur in medical area, and yourself as a investor, I understand as well, right? Among other things. And that's where this gap between your experience and your younger team members, I understand, allows you to create them a kind of a guideline or show direction, so that they actually feel this roadmap with their footprints, actually, with you guiding them once in a while. Yeah.
I would say in this moment, because we need to deliver good results in 2022, it's probably 60%, so it's more than 50 dedicated to things which they have to do because we have discussed with them and agree with them that these things have to be done and in a specific way in order to get those results. And we have 30 to 40% which is allocated to their specific input, because even if it's not a senior, if you start working on a specific task in several weeks, it's possible to have more experience than you, even if you have maybe 20 years in a specific field. So we are open to hear the bottom-up information which is coming from them, and adjust and improve the process we have defined with them before.
And this helps us move to the next round of this conversation, where we discuss the company. So I'll give I will throw a couple of facts about the company. Founded in 2020. So there's Dan Bugariu, active advisory, as you say, but also Catalin Balog-Beliu, right? The CEO with huge experience in dentistry and entrepreneurship. And the rest of the team, how many people in the rest of the team right now?
Well, the team has in this moment 10 people, 5 which are seniors and 5 which are not so experienced, let's say it like this. And in the moment we have pitched in order to access this investment round. We had a lack of seniors in 2 areas, platform development, product management, and chief marketing officer. And meantime, we are happy that starting with January, February, the team is bigger, and we managed to successfully attract to the team the right persons.
For those 2 roles, and especially the chief marketing officer, let me tell me, this new person, I understand, right, who will or have joined already, they come from pure startup, pure medical, or pure product, or educational kind of educational background?
And no, if we are talking just about the marketing role, the person has, actually all the seniors have 15 years plus experience in their specific domain. The experience is with bigger companies, and we had 2 months period of time in which we managed to adjust the language, the focus, the rhythm, the speed, and the way we are doing things. The startup, which is it's totally different compared with a big company, and you don't have the resources from a big company. You don't have the time. You don't have the luxury to do things perfect. What is important here to do things fast, the speed, the energy, the momentum, and finding the 80-20 report, it's more important than having a perfect result, and testing, because there are a lot of things we don't know, and without testing we don't have enough data to take the right decision. So we are pleased now that we are on the right track. We invested some time in order to create the right brand. It's important to have the right brand in the medical sector. Credibility is an asset for us. So we are building the credibility, reputation of the startup carefully. In the last 2 months, we carefully give attention to particularly this part.
Speaking of brand and recognition, by the way, Ulpia sounds like Latin. What does it mean? Is it anything with the wolf or something, or fox?
Not exactly.
Okay, that's the only thing I could find.
With Romania, Transylvania especially has a story behind it related maybe to wolves.
Do you mean Ulpia Traiana?
Exactly.
Oh, okay. So is this the one, the wolf, the she wolf that fed two twins, right? The Romulus and Remus, right? The founders of Rome.
Okay, there is a story too, but most important is that Ulpia Traiana was actually became the capital of ancient Romania after the Roman Empire conquered Thracia. And what it means for us is that when the old capital was replaced by Ulpia, the discipline and order and new way of doing things more successful, because we borrowed this from Roman Empire, place in the life of the citizens.
It's like upgrade, right, of the civilizational kind of values and so on and so on. And that's what you are introducing into it. Okay. Wow, interesting. So that's it's a very highbrow
way, disciplined, organized way to do things. And
I see.
It has a history, an important part. It's an important part indeed of Romanian history.
So it not, I mean, it doesn't only like sound well, but it has like interesting legends as well behind. Thank you, Dan. Let's move on to last, not least, round 5 will cover the financial standings or investment related details. So this is round 5 formula F3, funding for the future. And as far as funding by now, in a nutshell, how much you have received by now and what are the sources? I think this is helpful as well for early stage companies. And then we'll switch to the future plans and your current investment efforts. Yeah.
The value of this round was 240. In the end, we have collected more than we have expected.
Okay.
We are targeting our next round probably at the end of 2022 or at the beginning of 2023. We will see, depending on the results. We are not. We would not like to do it before is the right moment to do it. We think that in the next period of time we will have good incomes, and we have interesting chances to win on a grant, which will help us to invest more in the platform development and machine learning dedicated to those that customized and adaptive part I used in the front of the platform. So you need to solve them, and if you need to solve them well, you have to start collecting some data, being careful to, of course, GDPR concerns, but collecting enough data in order to provide to your customers that content which is valuable for them. So we have a plan. We have a roadmap to unicorn. If you are a startup, you need to have one. All the rounds are planned, and we know what type of numbers we need to achieve in order to go to the next level, next investment round.
And so you count now on a grant, I understand, which would help you what? Would help you like get funded a little bit easier and then without dilution, so that you reach your own self-imposed, I understand, milestones before you go into the VC kind of interaction.
Yes and no.
Okay.
Grant is an opportunity. We don't base our roadmap on a grant. Grant, it's possible. Mm-hmm. It's not a certainty.
Let me just tell you that a grant is not granted. Shouldn't we take a grant? Shouldn't we take it for granted? Yeah.
I love it how you put it. So exactly.
Here's a new rule. Rule of thumb for startups: don't take winning a grant for granted.
It should become a principle.
Cool. I mean, yeah. Okay. That's it, right? So grant is not taken for granted by you, and anyways, somewhere down the road in 2022, beginning 2023, you will, I mean, you plan to close an investment round, okay?
Yes,
who would be your ideal?
Exactly, the moment is depending on the grant opportunity, accessing the grant, and also how the subscription, the selling, the sales will go.
Yeah, of course. I mean, the more comfortable you are with the business results, the more confident you have a position with the VCs. That's for sure.
You have to access the next round in the right moment, in which is bringing you the leverage to go to the next level. Mm-hmm. And depending on the data you are collecting from your business and other opportunity, you decide at least with 4 or 5 months in advance when it will start to become the right moment.
Okay. So that the interaction with VCs is not only based on promise, but also on some execution of this promise already, and you see this like a relevant dynamics. Yeah.
Of course, we have a roadmap to unicorn, and the roadmap is based on results. So we have to get to those results in order to upgrade to the next level and attract the attention of the right VCs, because you would like to have the right VCs in our boat.
I just realized, I think you're probably one of the few, maybe the only startup on this podcast that actually mentioned a unicorn roadmap. This is interesting. I think we should probably write an article on this. So whether or not the early stage companies have this unicorn roadmap and are not swamped and overwhelmed with daily routines and challenges and so on. That's interesting. Dan, I think we've covered a lot, and interesting idea. Sounds pretty unique, at least in Central Eastern European markets. We have already covered your story on ITKeyMedia, our portal, and definitely we will keep following your successes. I wish you to run as quick as possible until the moment where you meet your unicorn, and then you ride it to finding at least 9 more, so that you become a decacorn. Dan, thanks a lot. Mulțumesc frumos. All the best. Good luck, and we'll stay in touch, I hope, with more successes from your side.
Alex, thanks for the article, thanks for the invitation, and thanks for your wish to become a medicorn in the future, in the near future.
Thank you. Bye.